Failing to plan is planning to fail, and that's what drove a recent confidential settlement we reached with a Central Illinois nursing home. That saying, failing to plan is planning to fail, is something I've probably heard from teachers, coaches, counselors, and bosses since I was old enough to be held responsible for my own success. And while it's true in life and business, it's especially true when dealing with known risks to patient safety. My name is Barry Doyle, and I'm a lawyer handling nursing home abuse and neglect cases throughout the state of Illinois. The basic framework for how most routine nursing home care is delivered is through the care planning process. It's a process that's intended to develop a series of steps to be taken day to day, shift to shift, to meet the care needs of the resident. There are actually 6 steps to the care planning process, but for today, we only need to talk about 2. The first step is the assessment, and this is where the staff evaluates the risks to the health and well-being of the resident. The second step is developing a care plan, and this is a series of steps that are going to be carried out day to day, shift to shift, to help assure the well-being of the resident. One of the standard areas that's covered by the assessment portion is the resident's fall risk. And there are a few reasons for this. One is that it's pretty well recognized in the long-term care industry that falls tend to beget more falls. Also, nursing home residents are at risk for serious injury from falls due to frailties associated with aging. There's also a federal regulation that provides that nursing home residents are entitled to receive supervision and assistance necessary to prevent accidents, and this includes falls. If a resident is identified as being at risk for falls, then they have to do a fall prevention care plan, which is tailored to that resident's particular fall risk factors. So, what happened here? Our client was admitted to the nursing home for rehab after a hospitalization for respiratory insufficiency. When she was admitted, she was properly assessed as being at risk for falls. She had intermittent confusion, a history of falls, balance problems, and took high-risk medications. The nurse doing the assessment got it right. She was at risk for falls. The next step should have been to do a fall prevention care plan, which would have been tailored around some of the risks that were identified in the assessment, but that was never done. In fact, during the days leading up to the fall, the nursing home staff made notes that she was engaging in high-risk behaviors. With no fall prevention care plan in place, it should be no surprise that she fell and broke her left hip. And there are multiple studies that show that a substantial portion of senior citizens pass away within 6 months of suffering a hip fracture. And sadly, that turned out to be the case here. She was brought to the hospital where surgery is recommended. She went through cardiac clearance, but as anesthesia was being started, her blood pressure dropped significantly to the point that the surgical team determined that the operation couldn't be done safely. She was placed on hospice and died 5 days after the fall. This is a situation which gives meaning to the saying, failing to plan is planning to fail. This settlement we reached was confidential as to the terms and the identity of the nursing home involved. We have a client who is very happy with the settlement we reached. If you think this was interesting, check out this one here.